Hello, today we'll be talking about sexual assault in women, mental health, and how this topic applies to the nursing profession. This research was conducted by Lauren Kraft, Jennifer Maurer, and Shannon Zimmerman. Women who have experienced sexual assault live with long-term psychological effects as listed on the bottom left-hand corner of our poster. This information has led us to our research question. In women who have been sexually assaulted, how does group therapy compared to no treatment influence the effects of mental health issues? Our method was an analysis of 7 articles related to our topic. The purpose of our study is to provide evidence-based research that nurses and mental health care professionals can utilize in the care of patients who have been sexually abused. The impact of sexual assault in women is reflected through the statistics listed below.
Our study evaluated the effectiveness of group therapy in women who have been sexually assaulted. Group therapy is a meeting of 5 to 15 people who discuss a specific topic with psychologists. The benefits of group therapy for women who have been sexually abused include the reduction of social stigma, promotion of acceptance, intimacy, empowerment, and healing, increased social capital, improved overall mental health, decreased psychological stress, and increased self-esteem, as shown in the graph below, which represents the effectiveness of a group called the Butterfly Program. Along with the benefits, there are barriers to treatment. These barriers include shame, embarrassment, social stigma, resurfacing negative feelings, failure to assess a history of sexual abuse, and the lack of community resources known by medical professionals.
We as nurses can help by performing assessments to identify women who have psychological effects after being sexually assaulted. We can use this knowledge of the benefits of group therapy to teach these patients and provide resources. We can also promote interdisciplinary care. Some challenges nurses face currently is the sensitivity of this topic, with limited time to build rapport with the patient, a lack of education, a lack of knowledge on resources and interventions, the complexities of the existing mental health problems, and a lack of experience and judgment on how to intervene. In order to improve nursing care of this patient population, our research suggests several guidelines. First, nurses should be more thoroughly educated addressing topics such as assessment of sexual abuse, procedures and laws, and resources available. This education should also include role-playing of clinical scenarios and supervised experiences working with sexual abuse victims. In addition, the nurse should reflect on their own feelings about sexual abuse, and there should be a routine identification process during initial assessments. In conclusion, group therapy was shown to be more effective than no therapy, and nurses should be informed on group therapy and how to care for these patients to manage the negative mental health effects of women who have been sexually assaulted.